when they entered the establishment. So things that are fairly easily corrected and not to do with overcrowding and those types of things. So well done. Let's keep it in this position. We continue to be, as you'll hear from Dr. Richardson in just a few minutes, in a precarious place. We are seeing still high case counts and the variant spreading through our community. So this is not the time to let down our collective efforts. And it was really nice to hear that we didn't have any charges issued to residential locations. The last number of updates that I've provided, there were some fairly decent sized gatherings that we were attending to. So thank you very much for that. From a recreation perspective, as you can well imagine, with the weather starting to turn, some outdoor winter programs have come to an end. The Nordic pole lending and snowshoe lending piece, a little difficult for both of those. And then the disc golf is ending as well. Winter golf is also scheduled to end this month, so it has very little time left in it. And then we will start to transition, obviously, to our spring and summer activities. And we have begun to open and offer some indoor activities as well. I just want to say a continued thanks to our paramedics who continue to support public health and other healthcare partners in a variety of fashions, including testing, and they are continuing to do that within the community. And it's a great expansion of our community paramedicine program throughout this pandemic. And I really want to tip my hat to the province for recognizing the value that community paramedicine plays in some of this. So another community-based testing clinic this Thursday at the Compass Community Health Center, this Thursday, March 18th from 1 to 4. Again, this is about testing. Vaccines, I know, is on everybody's mind, but just to remember that testing is still an important part of our program at the moment, and thanks to our paramedics. So as the mayor indicated, after a fairly successful start to the day, lots of people able to get online and book, and I'm hearing across the province over 60,000 people were able to book appointments. And of course, a number of those would have been in Hamilton, that they're now experiencing some difficulties which do not allow people to complete the booking, either an error message about a form that's corrupted or worse to that effect, or just not being able to complete the booking. It is a known issue, and the province is working on it. And at this point, we're just going to have to be patient and let that site get back up and operating. As a result, our hotline for vaccine booking and vaccine support is closed. The call volume was overwhelming, as people feel. And I just want to clarify that even when the online portal is up and going, our hotline does not have a back door into the system. We cannot book you any faster. And when the online booking tool is down, we can't book anyone in either, even for those who need our assistance. So we will be closing that hotline from time to time when the provincial system is down. We hope that this is a very short-term thing and that, generally speaking, we're there. All of our operators are there, and they will kick back into action if the site goes up again today and bookings happen, and we'll be there into the evening hours as well with support for those, again, who cannot access the online tool, lack of access to the internet or something of that nature, or if you do not have a health card. Please go to the online tool and follow the instructions. They're quite simple. On Friday, we had Dr. Richardson explain them to us, and they're quite simple. And on our webpage, it's all laid out. As long as you have your photo health card with you and know some basic information and have a calendar so you can check when you want to take an appointment, that's really as much prep as you need. And the system is quite simple when it's working. So again, we're in the hands of the province. It's a provincial tool. Our hotline is not closed because it's failing. It's closed because we, A, can't offer any support, and B, everybody was starting to go there in the sense that they could book through our hotline. And the answer to that is that you can't. We have no more ability than anyone else does to book people in. So we will continue to be there as a support as we go through things. But today has been, in some cases, a predictable start with overwhelming volumes and the challenges that come with that. But our expectation is that we'll get over those and move on. And as I say, for those who have difficulty, cannot book, our hotline is there to support you with some assistance. And again, please, if you are not eligible currently for a vaccine, then please do not call. Do not inquire about when you might be eligible, when those things are coming. You'll see that information publicized. You'll see that information on our website. We do not have unlimited resources to staff our hotline. So we're really hoping that only people who are eligible for vaccine who need to call in, or those who are booking for them, if that's the way it's working within a family structure, that you phone in with specific questions, because you cannot book. We're there to help. And if we can't help on the phone, we'll take details, sort out the issue, and give you a shout back. So we're there for you. And if we can keep those volumes down, then people won't be waiting too long on the phone. We'll get through those calls well. But when people are calling with all sorts of other questions, it just slows down those who really do need to book. And that's what we'd like to see happen over the next couple of weeks. So that's it for me. And over to you, Dr. Richardson.
Thanks very much, Paul. And maybe I'll just continue on with a comment around that, then get into the numbers around COVID-19 cases and outbreaks. But as well, as Paul just said, if you're not eligible right now, please don't go online and register or try to book. We know there's been some discussion that's going on out in the public about phase 2 populations and what's happening with phase 2. If you are phase 2, please wait until we move into phase 2 to start doing that registration process. We are finding that some people are trying to go on and see how they fit with the current criteria, not understanding that they haven't been adjusted yet to deal with that group. And so that's been part of the challenge as well. So make sure to take a look at who's eligible right now to book. And if you're eligible to book right now, eligible for vaccine, go ahead. And if you're not, please wait until a little later down the line. So in terms of COVID cases, we're at 11,315 reported to Hamilton Public Health as of today. That's 74 new cases from yesterday. These include a total of 270 local screen positive variant cases, with seven of those so far being confirmed as B117. 532 active cases continue on in Hamilton. There have been 295 deaths to date with no new deaths. We have a total of 30 outbreaks on our website. So you can see as well our number of outbreaks is creeping back up on a daily basis. We did come down in terms of those numbers, but they continue to increase. And there's 2 new ones reported today, one at Hats Off Group Home in Hamilton and another at Unit F5 at Hamilton Health Sciences Juravinski Hospital. Our 7-day moving average on cases is 66, and our weekly incidence per 100,000 is 77, and our RE is at 1.15. So again, these are all concerning trends for us here in Hamilton in terms of our weekly incidence, our RE, our overall numbers. And so we really need to keep in mind the control measures that people need to continue to have. And I'll come back to that in a moment. Paul's and the mayor have talked a lot about the launch of the online booking system. So again, it's there for those who are aged 80 and over. And as the technical issues get worked through, please be patient. There is going to be time for everyone to get a vaccine, and it's just going to take some time while the systems get settled in and we all get settled in with that booking system. We do continue to operate our 2 large-scale clinics, one at St. Joe's Healthcare Hamilton, and at Hamilton Health Sciences, there's the fixed site clinic that continues to give vaccine to hospital and community healthcare workers, as well as essential caregivers. And just to note, that's essential caregivers of those in long-term care and retirement homes, and not other groups. We are soon to launch, of course, the clinic at First Ontario Centre, which is going to open a week from today on Monday, March 22nd. A reminder, as per the piece on Friday, when you do book an appointment or able to get back online, remember you need your Green Ontario Health Card, your birth date, your postal code. You need to have an email address or a phone number. And at the time you book in, you're going to be able to schedule your first and second appointments. Those who want to do it themselves are on behalf of their family, and that's a great way to work with your supports and to book online once that comes back open. Please remember the address is www.hamilton.ca/vaccine booking. And the phone line, once things get back and up and running, will be there for those that don't have access to the internet or computer, or those who have challenges with their health card. As we go forward, starting next month, those phase 2 groups are anticipated to be added to the portal and to be looked at booking tools for ways that they can be reached. And so That is something, as I said earlier, that is yet to come. And at this time, please don't be using the portal if you belong to those groups. When it comes to our community healthcare workers, those who have registered through the vaccine registration online portal for community health workers, they will have received a confirmation email if they were able to successfully add themselves there, and they are in queue. They don't need to re-register. It's important to remember that once registered, our local healthcare workers will be called for vaccine in the upcoming weeks or even months as they become eligible. So there is a priority list for those in healthcare, and different groups are placed at different levels of priority by the province. And so as we work through those priority groups, as vaccine becomes available, people will get calls to register themselves. So we have heard from a number of people who have been frustrated because they're still waiting for a callback, and that is the case because we have had challenges both on the vaccine supply side and needing more vaccine to work through those priority groups, and in some cases because people belong to a lower vaccine priority group that we haven't been able to get to yet. When it comes to second doses, you'll remember that the province did extend the interval between first and second doses out to 16 weeks. And so all direction about second doses does come from the province as we move forward. And so as of March 10th, the second doses have been extended out to 16 weeks. So phone calls will be going out over the coming weeks to work with people who had an appointment already booked to get them rebooked into that 16-week interval. There are a few groups, though, that will remain at the initial intervals as per the product monographs, and those are residents of long-term care homes and retirement homes, and those in elder care lodges and assisted living facilities who are at the greatest risk of both exposure to COVID-19 as well as serious illness and death, and those who are at remote and isolated First Nations communities because of the potential seriousness of COVID-19 infection in these communities with limited available health care. So there is going to be further discussion on the dosage intervals for administering to Indigenous peoples who are beyond Operation Remote Immunity, which has been happening in the North. And so we expect updates on that over the course of this next week or so. So just in terms of the number of vaccine doses that have been administered, as of the end of day yesterday, we've completed 58,005 vaccine doses here in Hamilton. 14,000 of those are through Hamilton Public Health Services mobile clinics, with 6,500 administered at St. Joe's West Fifth Vaccine Clinic, and 37,000 through the HHS Fixed Site Clinic. So one of the things that you'll see on our webpage posted earlier today is the percentage of long-term care home and high-risk retirement home populations who have been vaccinated by home as of March the 8th. Just remembering that for retirement homes, they have not yet gotten through their clinics for second doses. And so those numbers are not up there for those low-risk retirement homes as of yet. Those second doses started yesterday and are continuing through till March 14th. Variants of concern. So as you heard me say, we have 270 screen positive cases so far. And we are indeed in this race between the vaccine and the variants. And we're very much asking that everybody, whether you've been vaccinated or not, to continue to follow public health guidelines to ensure our community is protected and to stop the spread of COVID-19. We do anticipate variants of concern to become the predominant strains of COVID-19 in the community over time. And it does suggest, science does suggest that the B.1.1.7 variant at least is able to spread more easily and faster. And so to keep them at bay, remembering staying home if you're feeling unwell, getting tested if you have COVID-19 symptoms or have been in close contact with a confirmed positive case of COVID-19, limiting gatherings to only members of your immediate household, maintaining that physical distance of 6 feet or 2 meters from others who are from outside of your household, wearing your face mask if you're indoors and outdoors when you're not able to maintain that distancing, and of course, washing your hands. So that brings me to St. Patrick's Day, which is coming up in a couple of days. Talked about this a little bit last week, but want to underscore again the importance of people not gathering with people from outside their immediate household for St. Patrick's Day, especially not in large numbers. So we know that being in the red zone, we are still able to gather with up to 25 people outdoors, but we do not recommend that you do that. Particularly as you watch our numbers climb, you can see why that is so very important, and with the numbers of cases of variants of concern. So raise a flag at home, have a green drink, put on your green clothes, meet with your family and friends virtually, have a good time, but please do not get together in crowded spaces or in large crowds. For restaurants and bars who are welcoming patrons, please make sure that only 4 people are seated together per table, and that tables are at least 2 meters or 6 feet apart, both indoors and outdoors, as per the requirements. And remember, for those who are not seated, they cannot be served food or drinks. They're not permitted to, people are not permitted to wander freely inside or outside on the patio with a drink in hand. And every food and drink establishment must be closed by 10 p.m. under the provincial framework. So please, as I said, we don't want to take the joy away completely on St. Paddy's Day. It's absolutely a time to celebrate as with other holidays that we've had, but to do so in a manner that's safe for you, safe for your family, and safe for our community. Back to you, Mr. Mayor.
Thank you, Dr. Richardson and Paul. And in addition to following our public health measures, you should continue to follow all of that and be vaccinated as soon as you can. And the number of ways that you can also help, though, is to help stop the spread is to download the COVID Alert app on your smartphone through the App Store or Google Play. You can donate to the local food banks, including Hamilton Food Share, Food for Kids, or the Good Shepherd, to just name a few. And if you're in good health, consider donating blood. Visit blood.ca to book an appointment. The demand for that is still always very high, and you can help save some lives by donating your blood. Shop and eat local whenever possible, so visit the hometownhub.ca to connect with and support our amazing business community that are doing online sales, whether it's restaurants or stores, and to continue to check on your neighbors, especially the elderly neighbors, to make sure they're doing okay and have everything they need. And while we may still be adjusting to daylight savings time today, this is not a COVID-related issue, but I encourage everyone to check your smoke and carbon monoxide alarms. Take a few seconds to test the alarm, check the expiry dates, and change the batteries. And seconds taken today may keep you and your family safe when the seconds count. So please make sure you do your check. And so Jasmine, it's back to you now for some media questions.
Great, thank you very much, Mr. Mayor. We have 4 media on the line with us today. We'll start with 1 question and 1 follow-up for everybody. First question will be to Maria from the Hamilton Spectator. Maria, you can go ahead.
Hi, sorry, it takes me a second to unmute. Thanks so much for the questions. I wanted to ask Dr. Richardson about housebound seniors and what's the vaccination situation for them. Like, I understand that other jurisdictions such as Windsor are administering vaccines at home at this time, and other places are looking into it. And I understand that public health does have a plan to do the same. And I was just wondering if you have a timeline for that one, for when that may be possible.
Hi, Maria. Yeah, the housebound seniors one has been a bit of a tough issue because ideally we'd have a vaccine that comes in single doses and is able to move freely about the city, but it's a little tricky from a logistics standpoint with the vaccines that we're dealing with that are recommended for this age group. So we are working on it and are working with our EMS colleagues to look at ways that might happen, but we don't have that yet, hoping to have something later on in this week.
Thanks so much. And my other question is also for you, Dr. Richardson. I was just wondering if you can comment on hospitalizations that are COVID-related in the city and whether there's any connection to variants of concern.
Yeah, so the hospitalization numbers are slowly creeping back up as well as we look at it. In terms of whether or not they're related to variants of concern, I don't have that with me per se in terms of how many of our hospitalized are actually variants of concern, but certainly overall numbers are increasing to some extent. We have had some outbreaks in hospitals that have been related to variants, so it's definitely playing a role. And how big a role we'll see what unfolds over the coming weeks.
Thanks, Dr. Richardson. Our next question will be to Nicole Martin from CHCH. Nicole, you can go ahead.
Thank you so much. We've talked to some Hamilton residents who are reporting, as you've mentioned, serious flaws and issues with the province's portal. Many with that error form has been tampered with. Obviously, the city of Hamilton is relying on this portal. Residents were expecting a smooth process today. Is this acceptable?
So I'm sure the province wants to fix this as quickly as possible. It's not just Hamilton that's relying on this. There are a number of jurisdictions across the province of Ontario. Look, the challenge is that whenever this opens up, there are large volumes of people, and in this case, large volumes across the province who all try and access at a very similar time. So my expectation is that they have a team working on this and we'll get it back up quickly. I will say for those, we did get some feedback in that those that were able to get on and did book through, it was a quick process, it was a smooth process, and it was a relatively easy process. So the tool works, and the tool has accepted an awful lot of appointments so far. And so I think once we get it back up and going, or once the province does that, we'll continue to see that performance. I know that they don't want it to be down, and they don't want to hear those types of issues as well. And my hope is that the team will get it back up and going as soon as possible.
Thank you, Paul. And how many appointments have been booked so far in Hamilton today with the portal? And when's the earliest appointment?
I don't think we have any of that information as of yet. That'll be stuff that we continue to go forward. The provinces continue to look at ways they can pull reports off for us so we can see how many are booked here in Hamilton and how many are booked by Hamiltonians, because of course those can be two different things, but we don't have anything on that as of yet.
I will say in terms of the time frame that we do know from hearing from residents who were able to book that they were offered appointments as early as today and others in tomorrow. So it's not a case of the appointments are being offered weeks from now. Those who were able to book and get appointments, we're getting them fairly quickly in the early stages, but of course they will book up fast and then it will get pushed out later and later.
Great, thank you. Next question will be to Lisa Pileski from CHML. Lisa, you can go ahead.
Hi. Oh. Hi, can you hear me?
Yep, we can hear you. Go ahead.
Okay, sorry, it was giving me a message saying I was muted. Just wondering, we've seen messages on social media. Obviously, there are the challenges with booking, but when people are able to get through, they're reporting that the sites that they're able to select for vaccination right now are St. Joe's and First Ontario Centre, if they're willing to wait until next week. Is there a reason that the city isn't able to offer people bookings through the mobile clinics and the pop-up clinics? Is it just a logistical thing at this point? And will that be something that will be added through the online portal going forward?
Thanks, Lisa. So right now, the challenge is that our mobile clinic staff are working on those retirement homes that I was talking about. So they're busy doing mobile clinics, but they're not ones that people can book into because they're at the retirement home. So as things go forward and as we move back into doing mobile clinics out in the community, those will get added in.
Okay, thanks. And then the other question is kind of just a reaction, I guess, from Dr. Richardson and whoever else wants to comment, that the Ontario Hospital Association has declared that it's officially, we're in the third wave of COVID-19 due to the rise in variants as well as hospitalization. So just wondering if I can get some commentary on that.
One thing I might just add to your first question, Lisa, just while I think of it, and then I'll come back to the piece about the third wave, is that we are, there will continue to be clinics like the ones that are being booked through primary care or the bookings that are being done for people who are in home care and that sort of thing, where they are being booked directly by either the provider or by somebody who's organizing that piece. So people won't be able to book into those ones through the portal. Those will always be done directly by those other groups. That's all just part of our trying to make sure that we can get access for people that don't meet the criteria that the portal is using right now, as well as targeting those that are in more vulnerable communities. So when it comes to the third wave, I mean, this is the question is, are we going through, as we did early on in the second wave, a series of smaller wavelets as we build up more cases, or are we going to continue to see a steady rise? And so we're watching this all very closely. I'm not sure, for me, Lisa, I would say that the piece is, we know where this will go if we don't get vaccinations in place and if we don't follow public health measures. And so the numbers are going up, they're increasing. It is the beginning of another wave, I would say. And it's just how big that wave is going to be based on whether people are following those measures and whether or not people are able to get vaccinated, how much vaccine we're able to get out the door. So we've seen it's quite striking in terms of what happens in terms of the numbers coming down when you do have people following those public health measures, not going out and about as much, not going between communities as much, all of those sorts of things as we saw with the lockdown that happened. And then of course, ultimately the stay-at-home order. So it does work to do those things. And it's really important that we do them until we get further along in our vaccination program.
Great, thank you, Dr. Richardson. Our next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for taking my question. A number of communities now have used the emergency lockdown break. So I was looking to find out, Dr. Richardson, if you know yet what would trigger that here, or if we are close to that here, or anything like that.
Thanks, Joanna. So essentially, it's a discussion about what's happening in each community. So it might be something a little different, in different spots in terms of the size and number of outbreaks that they're having, the number of cases they're having, the amount of variant of concern that's going on, and the increases that they've seen and how that's progressing in a particular community. So at this point, I'm quite concerned. You look at our rates, 77 per 100,000 per week in terms of what we have. Our variants of concern numbers continue to climb. We'll continue to look at modeling through this week and not modeling at case numbers throughout this week, and then look at where we think we should go from here.
Thanks so much. My next question is about those callbacks that were supposed to be made before the line ended on Sunday. There have been a number of people who did not get callbacks, who either registered or who had gone to the clinics. Can you talk about, how that happened? And, do you have any idea of how many did not get callbacks?
Thanks, Joanna. So we don't know exactly how many did not get callbacks ultimately, but by the time we got to the end of the day on Sunday, we needed to shut that down because we knew people would be accessing through the portal and able to register in that way, and we would end up in challenges in terms of how we were calling people back. We know that it was a significant amount of effort to get through to people. That's why we did ask that people make sure they were answering the phones when we called back, and that might get even more challenging as people were trying to work through the system, as you're seeing today. So people will be able to get through that portal. I can appreciate that it's been frustrating, and for those that did not get a call back before we got to the end of the day on Sunday, but we've gotten through a large proportion of those people, with over 6,500 having been vaccinated by Wednesday of this week. And thankfully, as you heard from Paul, lots of spots that are open in our clinics so that we can move forward and make sure that we get vaccine in those people's arms as soon as possible.
Thanks, Dr. Richardson. We have a bit more time, so we'll go through the list one more time. We'll go back to start with Maria from the Hamilton Spectator. So Maria, if you'd like another question, you can go ahead.
Thank you for the extra question. I don't know who this one would be for, but I was curious because I noticed that public health has also, provided some instructions on what to expect during when booking an appointment, and kind of offered some guidelines to avoid scams. And I was curious if you've heard anything about vaccine-related scams and an uptick in the community.
So fortunately, and I think it's good news, we haven't heard anything in public health about any uptick in scams. We were certainly concerned. We know that unfortunately there are people who have taken advantage of seniors over other issues in the past. And so that was why we wanted to be very clear about not having to pay for vaccination. You don't need to provide certain information when people are calling you up to follow up with you. But we haven't heard anything in particular. I don't know, Paul or Mr. Mayor, if you've heard anything.
I haven't. So policing, they could always call. I mean, this is, for all intents and purposes, a fraudulent effort. And so if it occurs to anyone, they can call the police and they'll follow up. But as Doctor pointed out, there are consistently scams happening in our community, especially as related to seniors. Whether they're asking for credit card numbers, a lot of different variations, and certainly the police are prepared to follow up if there's anything of that sort. But to date, I have not heard anything.
As we point out on our website and other pieces, this is a free vaccine, so you would never be asked for money in accessing the vaccine. So I think if ever anybody's asking, as the mayor said, for a credit card or any money whatsoever, or telling you you'll need to pay money, then that is obviously not a true site. So those types of things or other identifiers outside of you won't be asked for your health card over the phone. That's something you put in through the site. So those types of things are the easy ones to avoid. And we keep trying to give that information out so people are clear that this is a free vaccine, no cost to the public. So if they're ever asked for money, that would be a scam for sure.
Great, thanks everyone. Next question will be to Nicole Martin from CHCH. Nicole, if you'd like another question, you can go ahead.
That's great. Thank you so much. And this one's for Dr. Richardson. A growing list of European countries are halting use of AstraZeneca or waiting to approve it after reports of blood clots. How concerned are you about this? And do you believe Canada should stop using the vaccine?
Thanks, Nicole. So, vaccine safety, of course, is something we're all monitoring very closely around the world and looking at the experience of other countries and learning from them. So, we rely as local medical officers not only on the global science, but also on some really important people at the federal level, our National Advisory Committee on Immunization, who review these issues as well and are looking at these things. So, at this point, no, we're going forward. We don't have the batch numbers that have been concerned elsewhere in the world at this point. And of course, that's something that everybody is considering. If things change in terms of the review at the science level, we would let people know. But at this point, no, we still say the best time to get vaccinated is when you're eligible for a vaccine. And so those eligible for that AstraZeneca vaccine, we do encourage them to go ahead and get vaccinated.
Thanks, Dr. Richardson. We'll go next back to Lisa Pileski. Lisa, if you'd like another question, you can go ahead.
Hey, thanks very much. Just wondering, this is about the variants. I know that we've definitely seen the upticks, and I keep looking at the numbers. We've only got 7 confirmed cases of the B.1.1.7 variant, and I do understand that it takes some time for those lab results to come back. Is there kind of, at some point, is it kind of just assumed that those are all going to be screening positive at this point? And do you think that there's a likelihood of seeing one of the other variants? I know the South Africa and the Brazil one have yet to be seen here in Hamilton. Just wondering what that status would be.
No, that's it. That's absolutely right, Lisa. It takes week to 2 weeks to sequence any of those samples that is found to be positive on screening, and that's a lot of resources when you think about it across Ontario and across the country that could be caught up in doing that. So they're adjusting the strategy overall. We're basing all of our management now for every case of COVID-19. We treat them all the same way, regardless of what their screen results are. Although, of course, we are continuing to monitor those screen results to understand the overall epidemiology for us in our community. So, as we go forward, we wouldn't be looking to have those confirmed numbers be increasing in any large number because of those challenges that you pointed out. And they are going to continue to look for unique variants or new things that come forward at the provincial level and at the national level. But the focus will be on mainly dealing with the screen positive numbers and managing every single case, as I said, as a variant.
Thanks, Dr. Richardson. Next question will be to Joanna from the Hamilton Spectator. Joanna, you can go ahead.
Hi, thanks so much for the extra question. Dr. Richardson, I was looking to see if you know yet what the plan is to vaccinate adult users of home care, if you've, have a plan in place and when that will start.
So that's, thanks, Joanna. That's actually already begun. We've been working with the local health integration network with home and community care in terms of getting lists of people who are on home care and they are being called directly to come get booked into clinics. They're another one of those populations where the provincial online portal, unfortunately, is not doesn't work for them in terms of being able to get booked in successfully. And so we have staff who are continuing to do callbacks and work through getting them booked into clinics, as well as, a portion of these will also be those homebound patients that we talked about earlier. And so looking as well at mobile clinics and how they can help to service those who can't get to a clinic site.
Great, thanks, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today, so I will pass things back to you.
Thank you, Jasmine, and let's show our appreciation again for Bill Custers and the entire team at Cable 14 and Clear Cable, and to our media partners who continue to help share very important information with the broader community. So we appreciate that. And we also want to thank our public health teams and staff who have been redeployed to help with the vaccine effort. By all accounts, from people that have gone to get their vaccines, I'm hearing that it's a smooth and very efficient process. They do ask for you to fill out some forms before you get there as much as possible, which makes it even a more streamlined process. And we really thank them for all the work that they're doing, that are staffing those. These folks are working around the clock, and I know that it's not easy work, but it's important work, and they're all up for it, and they're doing their best to help our community get vaccinated. And so thank you for all that great work, for all of those great folks that are doing that work. For more information on COVID-19 and financial supports and any updates, visit our website at hamilton.ca/coronavirus. And again, on St. Patrick's Day, have the green beer, but let's not get together. Let's save it for another time. We've made many sacrifices over this past year on many of the great events that we all like to enjoy. And now at this date, where we're close to getting vaccines or are getting vaccines, and we're getting closer and closer to some sense of normalcy, let's not throw away that good work by congregating or getting together on St. Patrick's Day and potentially adding to the spread of this virus. So let's not do that. But you can celebrate in your own way, virtually or otherwise, with family and friends on a virtual platform, and share a green beer or a green pancake or whatever green you would like to consume, and celebrate St. Patrick's Day in some other way. We know the weather's been favorable, and we're all itching to gather with friends and family, except for today. It's a little frosty. Please try and stay within your own household. That is really the best way for you to prevent the spread. Continuing on with the mask, continue on with the hand washing and all of these other control measures will hopefully keep us in the red control category, which is just one step away from a lockdown. So we don't want to be there. But we'll be guided by the numbers, and if we have to go there, we will go there, because we certainly don't want to waste all of the effort that we put into getting us where we are today, and giving us the opportunity to let the vaccine do its work in our community. And yes, we're waiting for more vaccine, and yes, we want to put it in the arms of individuals as quickly as possible, and we will do so as soon as we get more supply. In terms of getting through the next days and our next availability, lost my train of thought there, is on Monday, March the 22nd at 3 p.m., so next Monday. In the meantime, things are looking better in terms of the vaccine. There's every sense to have a sense of hopefulness, even though it's a little clunky getting the vaccine done. You have to remember that we're vaccinating enormous amounts of people with competition in the supply space globally, as well as locally and nationally. And so no surprise that it's going to be a challenge and will likely continue. And so we need to be patient, we need to be determined, and we will make sure that everyone that's able to and wants to get a vaccine will get the vaccine when the prioritization schedule allows. So we'll see you next Monday on March the 22nd at 3 p.m. In the meantime, be kind and take care of one another.